Hi, Dr. Yeager. Many people are curious to know how can mental health affect student athletes both on and off the field?
We discussed the symptoms of depression in a previous video, and it is the symptom profile that actually begins to impact the student and the student athlete. What we see going on in depression, which the individual themselves may not be able to see, is the presence of a lack of motivation and energy to be able to perform activities. There's oftentimes a lack of interest or pleasure in seeking and completing things. So for the student, that lack of interest may impact the ability to focus on assignments, may impact the ability to focus on athletic endeavors such as understanding patterns, understanding plays, understanding or having the energy to engage in practice rituals. Additionally, what we frequently see is depression is a barrier to the individual's ability to concentrate. So when we're thinking about both academic and athletic performance, the ability to concentrate and focus are key factors in success. So if you're experiencing difficulty with focusing, if you're experiencing difficulty with finding the motivation to move things forward, and your peers are expressing concerns to you about these situations, it may be worth seeking assistance from your physician or the student health center in looking at the presence of anxiety and or depression as they frequently occur together. One of the things that you might be recommended to do is to engage in therapy with an individual. Frequently, the therapy is talk therapy. You may have heard of cognitive behavioral therapy, where individuals are asked to examine what they're experiencing and examine their belief system, their understanding of what they're experiencing. You may find that you're experiencing cognitive distortions where you're saying things to yourself that are negative, like I'm no good at this, or I'm not going to be able to make it, or I'm never going to understand this concept, which gets in the way of learning, which gets in the way of understanding what it is that you need to accomplish. Talk therapy is probably the most common approach to treating depressive disorder. However, there are several medications that are used for depression. Typically, the selective serotonin reuptake inhibitor, or SSRIs, are the common approach to depressive treatment. There are other treatments, though, that are used if an individual is not responsive to SSRIs. That will be between you and your medical team to determine the best and most effective treatment moving forward. If you have questions, please reach out to your healthcare provider and seek assistance and direction in the most appropriate and effective way to address your depressive disorder.